Regenerative medicine is rapidly evolving, and it's based on assisting the body's healing mechanism. Platelet-rich plasma, or PRP injection, is a treatment for orthopedic injuries and conditions. Orthopedic surgeon Dr. David Duffner reveals how this innovative one-injection therapy works.
Well, there's a new therapy that's based on triggering your body's own healing mechanism. So we use primarily platelets, which release chemical signals that activate other cells in your own body to create a healing reaction. The product is actually derived from the patient's own blood. So it's your own blood. We take a sample, we put it in a centrifuge which spins it, and the red cells go to the bottom, and the serum goes to the top, and in the middle is the platelet fraction. We isolate that, and then we use that as the treatment. So we're actually concentrating these platelets that your own body makes, and we're using that to manipulate the healing reaction and create a healing reaction in your body. Once we have the plasma-rich platelet isolated and it's in a sterile container, then it's given just as a simple injection. So in the past we've used local anesthetics, we've used steroids, people call it cortisone, but it's different types of steroids. Steroids really aren't great for you in the long run. They relieve inflammation, but they have a lot of negative side effects. So it's simply an injection, and it can be into a joint or into a muscle or into a tendon where you need to create a healing reaction. Once the injection is in the joint or in the damaged area of your body, then it starts the chemical reaction. It starts recruiting your cells. Now it can take anywhere from a couple of days to a couple of weeks. And actually the effect lasts for months because it's a cascade. It's a sequence of a healing reaction. It's not just one thing.
Dr. Duffner shares a patient's story.
One of my patients was a healthy gentleman in his 80s who was a very active gentleman, in fact a volunteer at the hospital, and his knees bothered him to the extent that he had difficulty getting in and out of a car, getting up from a chair, and he was having to use a cane or having to push up to get up out of a chair. So he had the treatment, one injection in each knee, and the effect was remarkable. He had relief within a few days. He came back for a checkup a week later, and I said, "How's it going?" And he showed me. He didn't tell me, he showed me. He literally sprang up out of his chair, and he said, "Look, I couldn't do that before."
You know, what can you say when something's working and you've been all that pain and you had trouble walking? Hey, I don't have that anymore.
The great thing about this type of treatment is it's natural. We use the body's own cells, mainly platelets, to stimulate healing. So this has evolved mainly by having the ability to process blood and extract the platelets. And it's actually not that difficult. The whole procedure takes about 20 minutes. The success rate is over 80%. There's not much risk here. The downside is minimal. It's a numbing shot and then a therapeutic injection, and that's it.
Dr. Duffner shares another patient's story.
I had a patient who had this large cyst in front of her knee. It was right in front of her kneecap, big as my fist, over 100 cc's of fluid in that. So we took the cyst out, but the fluid came back. And after that, I tried several different methods of taking the fluid out and creating scar tissue intentionally so that it would heal and not fill up with fluid again. And I finally used the PRP, one injection, one time, totally got rid of the problem. She was really happy.